Hi there, my name is Dr. Jenn Hughes. Thank you for coming to this lecture. This is the TBI therapy webinar, the Ketogenic Diet for Traumatic Brain Injury, or TBI. It's February 13th, 2018. If you have any questions during the event, you can log into your YouTube account. You have to sign into that, and then you can type in a question to me. I'll be glad to answer along the way or at the end of the lecture. This lecture should take about 25 minutes. If you have any questions along the way, let me know. Again, my name is Dr. Jenn Hughes. I'm an osteopathic doctor. I am from Georgia. I went to the School of Arizona College of Osteopathic Medicine, and here's a great picture of the Grand Canyon. Learning objective. What are we going to learn about? What's a TBI? What's a traumatic brain injury? What are ketones? What is the ketogenic diet? And how does the ketogenic diet help traumatic brain injury patients? What is a traumatic brain injury? This is a pretty cool animation. You can kind of see what's happening. You're getting an injury oftentimes from the skull hitting an object in the front, and then you're also getting oftentimes what's called a contra-coup injury when the brain hits the back of the skull. This is a very common injury, especially in motor vehicle accidents. Sudden violent blow or jolt to the head could be due to also to a blast from a military accident. The brain collides with the inside of the skull, bruising the brain and tearing of fibers and bleeding. What happens after a TBI? And this is where it gets all down to the nitty-gritty biochemistry, which is important to understand. Oftentimes you'll have brain swelling, and what the problem with swelling sometimes is the swelling of the brain actually causes inflammation that can't be reduced. So sometimes surgeons actually have to go in and remove parts of the skull in order for that swelling to be able to be alleviated. When you actually get this swelling, immediately glucose goes to the area to try to help the injured area get repaired. Same thing kind of happens when you sprain your ankle or any other part of your body. Just when the brain gets inflamed, it's much harder sometimes for that area to repair itself. The brain is flooded with disproportional responses, so it's pretty much disorganized in its repair. It's not as easily controlled as far as the inflammation and swelling goes. Love this quote. The brain is in a metabolic crisis in a concussion. Potassium ion from inside the cell going extracellular, calcium ions going intracellular, neurotransmitters widely released in a chaotic manner. It takes energy to pump that potassium back, put the neurotransmitters back on so the cell can function. This is Robert Cantu, MD. He's done a lot of work in understanding how the chaos of brain injury causes a metabolic crisis. And I think this is uniquely to our argument today about ketogenic diets for TBI. It's so important to have the energy but to repair the brain, but that energy needs to come in the form of a controlled energy release to correct the chaos. And that's what we're going to be talking about today. The biochemical and physiologic responses after TBI. And this is a pretty unique slide in the fact that we're talking about something called cytokines. There's a disproportional pro-inflammatory cytokine production and release. So if the brain's inflamed, there's proteins that are cell signaling molecules that get released, and there's a high amount of those that are getting released in a disproportional fashion. There's also something called increased counter-regulatory hormones. These hormones work against the action of insulin. So in that regard, they could be something like glucagon or cortisol. These are actually not letting the brain absorb the nutrients it needs to heal. It's just like if a person gets all excited about a car accident, they jump out of their car, they are so excited, they're yelling at the other car, they're not healing. And this is what happens sometimes in the brain. They get these excitatory hormones that keep them from healing. Their cortisol shoots up, and they're just like the person sort of screaming. They don't have this ability to easily rest and go back and chill out. Hypermetabolic and catabolic states. What this means is that the brain is in a state where it's trying to consume energy at a rapid rate. However, it's in this really hyped up state, so it can't, it's wanting to break down as well as build up at the same time. So it's trying to take up as much glucose, but none of that glucose is getting to the spot it needs to do to help heal. And that impairs nitrogen homeostasis. And basically what that leads to is something called oxidative stress. So it's basically like there's a fire in the brain. That fire is not just keeping the brain warm or helping it like a fire in your house. It's actually burning up the house and destroying, through these inflammation proteins, through these tiny regulatory hormones, destroying what actually would be an important thing to have in the house, a fire, but it's actually gotten out of control. So that's the best way to say it, to kind of understand this, is it's like a fire that's gotten out of control. And this is another way of looking at it. There's a disturbance when you have oxidative stress from a traumatic brain injury. There's a disturbance in the balance of reactive oxygen species. These are also known as free radical and antioxidant defenses. If we think about an antioxidant like the vitamin C from an orange, this orange is outweighed by the vitamin C, or the antioxidants here are outweighed by the oxidative stressors in the brain. Like I said, the house is caught on fire and there's nobody there to put it out. The antioxidants, there's not enough water, there's not enough things to control that fire. Oxidative stress from a TBI. What does it do? It impairs cerebral vascular function. All this inflammation, what does it do? It stops the blood flow to the areas of the brain that need it. Impairs circulation. Impairs the energy metabolism, as we talked about. Damages mitochondria, ultimately damaging the ability of the brain to make energy, and the DNA that composes it, that composes the cells of the nucleotides of the brain. Symptoms, what do we get? Fatigue, disturbances in sleep, memory loss, decreased eyesight, headaches, sensitivity to noise, cognitive impairment, changes in mood, insulin resistance, hormone abnormalities. I haven't met any traumatic brain injury patient that's mild to severe that doesn't have at least one of these symptoms. There's all of these symptoms. Most commonly is the fatigue. Disturbances in sleep are almost always there. Memory loss, almost always there. Some patients have decreased in eyesight. Cognitive impairment, almost always there. Hormones. There's all this challenge with TBI patients. Some people say it's a loss of oxygen, having enough oxygen and energy to the brain. It's really the right amount of controlled energy to the brain. And that's the best way I can explain the essence of this lecture is ketones help us manage and modulate the energy combustion of the brain. How to decrease oxidative stress. Ketones. Ketones decrease oxidative stress, increase antioxidants, and scavenge free radicals. This is all solid studies that have been around for a little while. We've known about these types of work for quite a while now, and we're just realizing how important the ketogenic diet is for TBI. What are ketones? Ketones sound like a big word, but in essence, they're really just what happens when you run out of carbohydrates. We all burn ketones every day, where our body starts breaking down fat when we stop eating a bunch of glucose. Not eating too many, sodas and crackers and cookies, we start burning ketones. And it's basically giving our brain and our body an alternative energy source. How does this work? So glucose, and this hamburger is not purely glucose, but you think of the bun as mostly glucose. Some of the tomatoes and ketchup you put on the burger. If you cut all that out, what happens is the blood sugar drops. You're stopping. You're not using insulin or glycogen anymore, and the body starts using fat. And this can take a while. It depends on how fast the person's metabolism is. And the body will start burning fat for energy. Some people say it may take 4 to 8 hours for the average person. Sometimes it's even longer, so sometimes 12 hours, depending on how much you eat. Ultimately, what you get is ketosis. You get this when you fast. And I don't know if you've ever fasted as a patient, but you'll get oftentimes a very clear brain. Your brain is much more stabilized when you're in ketosis. We don't recommend most patients fast for TBI because it's too hard on them. They're already struggling with this hypermetabolic crisis. Fasting can sometimes just make them even more stressed. However, it does decrease the oxidative stress in the brain. So we want patients to not have to fast to get to this ketogenic state or ketosis. This is what I like to talk about, just to make it understandable. Glucose and carbohydrates are like kindling. So if you've ever built a fire, every every season, I basically go back and visit a little mountain cabin, and I have to start a fire. The unique thing is I use some kindling when I start the fire, as most of us have done. And then what happens? Sometimes that fire gets really big, and the kindling catches on and it's really hot. And then in a couple minutes, if I'm not watching it, the fire just goes right out. So the fire burns really hot for a bit, and then it goes right out. And if you think about the brain of a TBI patient, what's happening? Sometimes there's a lot of fire. They get all excited, or they get angry, or irritable, or inflamed, and then the fire goes out, and they get all depressed. It's this hyper sensitivity to the mood. So burning on glucose or carbs, it can make your brain and the energy it gets to power it more like a little kindling fire. What happens when you're using logs, though? Once you get that kindling going, which we all use glucose, even if we're eating fat all the time, we're still using some glucose in our brain. Once you get that fire going, though, you throw a little bit of ketones, which are like logs. What happens with logs? They burn a little easier. And actually, these logs can handle a lot more heat, so they can burn hotter but more evenly. They can take a hotter flame and not burn up and burn more evenly. Which burns more even? The ketones. Very simple concept. I'm going to talk about it in just a minute. The other analogy here is that the ketones are what it's like giving your brain energy to run a marathon. They say the heart's primary fuel is actually fat. So if you're going to run a marathon, you're going to do much better having either a very continual dose of carbohydrates, so you have kindling there all the time, for example, or you have fats and they can keep you going for a long time. What does this do to the nervous system and the brain? It stabilizes it. We've known for years that ketones reduce the seizure threshold. That's calming the brain down. You think about what's happening here. If you're having an even burn of energy in the brain, you're not getting the likelihood of a thunderstorm or a shooting spark, which is what happens in a seizure. You get like a brain storm. So you're getting sparks that are flying everywhere. When you get an even burn with these fats, these ketones, you're going to have a much lower seizure threshold because it's just going to burn easily. It's going to handle the heat better and not get out of control. What happens after that? You can enhance your brain organization. You can correct the metabolic crisis. You can overall balance those counter-regulatory hormones that are breaking down your brain and causing those fires in your house. Another analogy is very simple. Ketones are like diesel fuel. Glucose is like gasoline. I like this analogy a lot too. Diesel fuel has a higher flash point. This is a chemistry term. Flash point basically means it's a lot harder to ignite diesel fuel. Same thing, kind of like the log, right? It's harder to throw a log in the fire and just start it right back up. But once it gets going, it's much harder to oxidize. So that, it's harder to produce oxidative stress, less flammable. So what does that mean? There's less excitability and there's more even burn. You don't have nearly the neuroexcitability that you have from gasoline, which is actually causing all this excitable. When you put gasoline in your car, it's never just gasoline in a liquid form. It's gasoline in a volatile vapor form. So one thing to think about too is you put a bucket full of gasoline right next to your car, or maybe just beside your house. You throw a match in it, what happens? It catches on fire and might like really kind of blow up. That's called a flash point, right? So Gasoline has a low flash point. Diesel fuel has a high flash point. You throw a bucket of gasoline next to your house, you throw a match in it, what happens? Nothing. The diesel fuel doesn't catch on fire. A little match is not flammable enough. Diesel fuel is not putting off enough vapors to make that um, fire happen. So you need more flame. You need a little more heat to get it going. But once it goes, it's a little easier to burn. So it's less flammable. So the excited what that means and how that translates into the brain is that there's less inflammation or less oxidative stress with ketones, which are much more like diesel fuel. And the brain is much more like a diesel engine. Brain likes to work all the time, kind of like an endurance runner likes to run all the time. Brain likes to work like a diesel engine, which can go a lot longer. Those diesel engines, they can last 40, 50 years sometimes, and they burn much more efficiently. So a diesel engine, not saying that that's the best thing for the environment to burn, but they do have a higher, a more efficient burn. And the best way to describe that is uniform combustion. In the technical mechanical literature out there, a diesel engine is going to last a lot longer, just like your brain when you put fats in it. So a very simple analogy. If you want to think of your brain like a diesel engine, it's going to last a lot longer. It's going to be a lot more efficient. It's going to be a lot less inflamed. Ketones, what else do they do? Increase GABA. What is GABA? GABA it's a calming neurotransmitter. That's all you need to know at this stage. So it calms the brain, unlike some of the other neurotransmitters, namely glutamate. Glutamate is an excitatory neurotransmitter. If somebody's coming at you at a knife, you better have some glutamate flowing in your brain. But most of the time, you don't need tons of glutamate flowing around. So if you have somebody coming in with a knife, you want fear and anxiety. But most of the time, you want more GABA. You want to have less depression, less fear, less anxiety. And that's what ketones will do. Ultimately, as we talked about, there's less oxidative stress with ketones and overall improved neuroprotection. This is a complex slide here. Just do your best to understand this. This is all the science. The neuroprotective actions of the ketogenic diet. What does this mean? How is this? So we're reducing metabolic stress. So if you're a runner, you want to have a long run. You don't want to be stopping and starting. That's the other analogy. With gasoline, carbohydrates, you're getting some fuel, and then all of a sudden you're like, gosh, I'm kind of getting a little worn out. So you're going to have a challenge, maintaining a long run, an endurance run. So that metabolic stress is going to take its toll on you. Increase resilience to neuronal loss. So the neurons are going to be more viable because you're not pressing on the gas pedal all the time. And then slowing down. You're pressing on the gas pedal at an even pace over time. The neurons can handle that a lot easier. Upregulates energy metabolism genes. So these genes are going to be happy to give you more energy because they're not, you're not stressing them quite as much as with when you're burning gasoline or glucose. Stimulates mitochondrial biogenesis. This basically is we're creating new mitochondria. So that's exciting because more fats, more energy ultimately, because you're going to create more mitochondria that can metabolize those fats and turn them into energy. Enhances alternative energy substrates, basically just what I said, and promotes the synthesis of ATP. One more, interferes with glutamate toxicity and bypasses an overall toxicity in general. Well, brain burning healthy fats, burning ketones is going to ultimately give you less neurotoxicity as well. It's going to be able to handle that toxic load of the body. And bypass the inhibition of complex 1 in the mitochondrial respiratory chain. Just take that, look up the study if you want to know more about that. The ketogenic diet. Ultimately, the key for this diet is high fat. This is kind of the opposite of the 1980s, where we said that high fat was not healthy. We thought fats were dangerous, and at that time, in many circumstances, high fats were, because high fats at that time were things like margarine, and trans fatty acids from safflower or soybean oil that had been partially hydrogenated. And they were partially hydrogenated so they could sit on the shelf for long periods of time. Crisco is another example of that. You don't want to go eat a bunch of Crisco or partially hydrogenated fatty acids. And high fat ketones are things like avocados, and that may be here, and we'll talk about that. MCT oils and coconut oil. That's what I think about for high fat. Olive oil is another one as well. You want to have adequate protein. I'm not telling people to eat the Atkins diet. Remember that Atkins died. He ate meat and cheese and he died of a heart attack. We don't want people eating fats that are going to give people heart attacks. So keep that in mind. This is not an Atkins diet. This is a high fat, low carbohydrate, tons of vegetables. Really important to remember that. So the ketogenic diet doesn't allow people to eat meat, fish, lamb, poultry, eggs. I generally recommend against pork. Leafy greens, as well as most all greens. Some nuts, avocados, and berries. We like low glycemic berries, blackberries, blueberries, raspberries. Some sweeteners. I really don't like monk fruit, and then as I said, the oils are really key. If you're eating, you have to have some carbohydrates, but you put coconut oil on them, you're going to get a lot of those ketones to your brain that you otherwise wouldn't get. What we have to be careful with on this diet, and like I said, we're not doing this diet indefinitely forever, but for about 3 months, we recommend that patients eat low amounts of wheat, corn, rice, and cereal. We recommend that they eat limited amounts of these really high glycemic sweeteners, sugar, honey, maple syrup, low amounts of high glycemic fruits, apples, bananas, and be careful with potatoes. Potatoes can convert right to sugar. Put a lot of oil on them though, and you can keep them in a lower glycemic, more ketogenic state. So we're not telling people to go completely off all carbs necessarily, but reduce those significantly. And some people just need the calories from some carbs. So if you do eat low glycemic carbs, we recommend, and I don't have it on this list, but we have wild rice or brown rice, and then you add certain types of oils to those. Changing somebody's diet, just in my experience as a physician, is like changing who their family member is. We don't recommend people go out and do massive changes to their diet. If they're not already eating somewhat healthy, then we just want to encourage them to eat some healthy fats at first, and a few more vegetables, and then slowly start to reduce their grains. So this isn't always an overnight process. TBI therapy protocol. We're beginning the ketogenic diet at the beginning of TBI therapy treatments. These are usually 3-day protocols, sometimes 2 days. And we're encouraging patients to start at that time, if not sooner. We don't want patients doing this more than about 3 months. Most patients will need some healthy carbohydrates, usually at night. After that, if you go completely ketogenic, you can negatively affect your thyroid after a certain amount of time. So I love this book, Fat for Fuel. Dr. Joe Mercola has written books on this. Dave Asprey's also written a book or two. One's called Headstrong, another one's called The Bulletproof Diet. Talks a lot about ketones and the benefits and dangers. We recommend we send everybody home with a book like this. And I think, if you're going to do this, and Mercola actually has a cookbook as well that's worth reading, whether you're an athlete or whether you're a cancer patient or a brain injury patient. There's merit for a lot of these types of diets. Consider intermittent fasting. We don't recommend patients do this right away, just because it's just cognitively stressful to tell someone to fast. They're not always ready to do that. Brain octane. This is sort of the magic bullet in keeping people ketogenic, made by Bulletproof. We like this one because this oil does not react with the plastic, so we've been told. And in the bottle it comes in, you can also buy this type of MCT in glass bottles. We don't recommend just any one, because sometimes the MCT oils are processed with hexane as they're derived. So make sure you get a really good quality of MCT oil. Some people are like, well, why don't I just eat coconut oil? Coconut oil is great, got lots of ketones in it, but not nearly the amount of ketones that a brain octane product would have. So patients that do this, some of them need to take the brain octane after dinner or with their dinner, but don't do it before exercise because it can upset your stomach. So most people take about 2 tablespoons of this with their meals. We have a question that says, what do you eat while you're fasting? I think that's a really good question. Most patients, I tell people not to eat anything but vegetables to start, and then eventually you can go on to a completely water or even a green juice fast, no sugar juice. If you do decide to do that, be advised by your naturopathic doctor or a nutritionist or your physician. Ketogenic diet and TBI. This is just a summary of what we've talked about. What are you getting? Reduced oxidative stress. Remember, the diesel engine doesn't burn as easily, has less overall inflammation. So you're not getting the oxidative stress or the inflammation that comes from a brain injury. You're decreasing the neuroexcitatory glutamate. Glutamate makes you go kind of crazy. It creates a lot of mood issues. People get excitable and then they kind of burn out. If you are getting chased by a bear, that's what you want flowing in your brain. If you're not, you need more GABA, the calming neurotransmitter. And what we've seen with ketogenic diets, in a similar way as CBD oils, for example, you're getting more GABA flooding into the brain. Overall, that'll increase. Some people ask, why not just take GABA? You can take GABA. You can take GABA over time orally. It's just poorly absorbed. We found a good product through a company called Quicksilver that's really been beneficial to our patients as far as getting GABA sublingually. Overall improvements in cognitive motor function. Cognitive is key. This is really important as far as your brain goes, to have the right kind of uniform combustion. Think about your brain like a diesel engine or like a log burning slowly. You want that uniform combustion. Just like an endurance race, your brain is running all the time. So you never get to stop. You never get to rest. Just me, when I'm sleeping, I'm burning 20% of the air I breathe goes to power my brain. It never stops. So you need that endurance type fuel to improve your overall functioning. So cognitive and motor function have been seen. Epileptic seizures since 1921, we've been putting patients on a high fat, appropriate protein and healthy vegetable diet. And I think as long as you don't overdo the animal protein aspect of this and get healthy fats, then I think you're on the right track for lowering that seizure threshold. Think about glucose as increasing those fires or those thunderstorms or those sparks in an uneven distribution, kind of like kindling. So it's really important that you understand how seizures can happen if you eat too much glucose. And oftentimes patients will be craving more glucose, even TBI patients, if they eat it, because it's this constant up and down rush. So we have a question: 70-mile runners at one long marathon, African Maasai Kenya tribe cannot do it without can or cannot do it with fast burning kindling. A lot of these athletes, they may come from a vegetarian diet if they're from Africa, because that's all they have. They don't have a high fat diet, but they can, usually they're adapted to using a low glycemic diet. These patients or these Kenyan tribe members, they're not eating white flour most of the time. They're eating roots and tubers with a pretty high fiber content and a low glycemic content. So that's one reason they can adapt to running such long distances, and their bodies are so used to doing that. So thanks so much for everybody for coming to this lecture. I hope this provides some enlightening understanding of how your brain works better on a high fat diet, a ketogenic diet. Please be careful with partially hydrogenated fats, margarine, butter. Even those could be dangerous for some patients. So grass-fed butter is what we recommend, or ghee butter if you're going to use that. If you're cooking, we recommend a saturated fat like coconut oil or even avocado oil as a cooking oil. Call me if you have any questions. Again, my name is Dr. Jenn Hughes. Thanks very much. Call our clinic if you'd like to learn more about what we do, along with the ketogenic diet to help traumatic brain injury patients. 303-447-1257. Thanks very much.